My name is Shannon and I'm with Pioneer Medical Foundation. If you're living with diabetes, checking your blood sugar is one of the most important things you can do to stay in control of your health. In this video, we'll go over the tools we use, how to check your blood sugar step by step, and what your results, including something called your A1C, really mean. Let's start with the basics. To check your blood sugar, you'll need a few simple tools. Don't worry, once you get the hang of it, it becomes part of your routine. Glucometer. This is the small device that gives you your blood sugar reading. Test strips. These go into the glucometer and collect a drop of your blood. Lancet and lancing device. This is a small, spring-loaded needle that pricks your finger to get that tiny drop of blood. Some people use continuous glucose monitors that check sugar throughout the day using a small sensor. But in this video, we're focusing on finger stick testing. Still very common, reliable, and affordable. Here's how to check your blood sugar step by step. You can do this at home, at work, or wherever you need to. Just keep your supplies clean and organized. Wash your hands with warm water. This helps prevent infection and gives more accurate reading. Insert a test strip into the glucometer. Most meters will turn on automatically once you do. Prick the side of your fingertip with the lancet. The side hurts less than the center. You only need a small drop of blood. Touch the drop of blood to the test strip. The meter will beep and show its reading. Then read your results. In just a few seconds, you'll see your number. Depending on your doctor's advice, you might check your sugar once a day or several times, especially before meals, after eating, or before bed. Let's talk about what those numbers mean. For most people with diabetes, ideal blood sugar levels are 70 to 130 before meals, and then 1 to 2 hours after meals, ideally less than 180. But your doctor may set different goals based on your age, health, and other conditions, so always follow their guidance. Along with daily finger sticks, your doctor may order a blood test called the A1C every few months. This test shows your average blood sugar over the past 2 to 3 months. Here's how to understand your A1C results. Below 5.7% is normal or not diabetic. 5.7 to 6.4% is considered pre-diabetic, and then 6.5% or higher is a diabetes diagnosis. Around 7% is a common target for people with diabetes. Keeping your A1C close to your goal helps protect your eyes, kidneys, heart, and nerves from long-term damage. Monitoring your blood sugar may feel overwhelming at first, but it gets easier, and it's one of the most powerful ways to stay healthy with diabetes. Check regularly, as often as your provider recommends. Write down or log your results, or use an app. Share your numbers with your doctor, and never hesitate to ask for help. You are not alone in this. With the right tools and support, you can take charge of your health, one reading at a time.